Hello, my name is Brian Cavazos. Today I'm going to be talking about Fragile X syndrome, its symptoms, how it's genetically inherited, and basically just technical information about how it works. So let's go ahead and get started. Fragile X syndrome is a genetic code that affects 1 in 5,000 people, which causes a range of developmental problems that include learning disabilities and cognitive impairment. And cognitive impairment is basically like a decline in brain functions, such as memory loss and stuff like that. Usually, males are more severely affected by this disorder than females, therefore, is inherited in an X-linked dominant pattern, which means that a mutation in one of the two copies of a gene in each cell is enough to cause a disorder. And as you can see here in the bottom, there's a normal X chromosome, tout looks, and a fragile X chromosome, the fragile site. Some of the major phenotypic features in males: behavioral characteristics such as ADHD, ADD, autism, social anxiety, and increased risk for aggression. Physical characteristics: large ears, soft skin, large testicles in males, and double jointed fingers. Some more features such as a long face are more common after puberty. And here's some before and after pictures of patients with Fragile X. As you can see, the long face. Wow. Some of the major phenotypic features in females. Females have very similar characteristics, though often have much milder intellectual disabilities and milder presentations. A very small percentage of females with Fragile X will have no apparent signs of the condition. Some may have moderate or mild learning disabilities, emotional and mental health issues. And here's one of my case studies that I found on the internet. Nick Hill is a 22-year-old Fragile X syndrome child who was placed in the vocational groups at Swami Brahmanand Prathistan. According to a very credible source, he was very aggressive and hyperactive when he first arrived at school. This seemed very strange to Nikhil's mother because, according to her, Nikhil was very restless and would roam around the house aimlessly. His mother was very worried about Nikhil and decided to seek help. There is no cure for Fragile X, but there are certain therapies that would target certain symptoms. The professionals at the Special Needs Center discovered from the extensive work with special kids with this unfortunate disease. With the appropriate therapy and support, all persons with Fragile X can make progress. Medication is often an important component of the treatment. This rare orphan disease, which affects 1 in 5,000 people, occurs when a single gene, FMR1, on the long arm of the X chromosome shuts down and fails to produce a protein, FMRP, which is vital for a normal brain development. Phenotype and natural history. In order to diagnose Fragile X by chromosome test, this test was not always accurate and was first used during the 1970s through 1980s. And the FMR1 DNA test replaced the chromosome testing. Fragile X symptoms: ADHD, ADD, autism, and social anxiety, and increased risk for aggression. There is no cure for Fragile X, unfortunately, but the Fragile X treatment depends on severity, of course, just as any other treatment. Behavior therapy, which is a therapy focused on modifying harmful behaviors. Medications such as sedatives, muscle relaxants, antipsychotics, cognition enhancement medications, and vitamins. Fragile X inheritance risk. Fragile X is an X-linked condition, which means that the that the gene is on the X chromosome. Since a woman has two X chromosomes, a woman premutation or fetal mutation has 50% chances of passing on the X with a mutation in pregnancy. So males, which only have one X chromosome, would pass that X chromosome to their daughters. So it's messed up. Here's my tree, as you can see. They're all very similar, but so different. And that's it. Thank you guys for watching my video, and that's it.